Hello, and welcome to part 5 of the lecture on chapter 10, Controlling Microbial Growth in the Body. This section will be the shortest of the parts of the video, um, just because it's just a few slides that don't really fit in either the previous section or the next section. So we had finished off looking at the different ways of assessing the efficacy of these different antimicrobial drugs, and we finished off with the minimum bactericidal concentration test. And we will be moving on to how do we deliver these drugs to patients? And so that this is referred to as routes of administration. That is, how is that going to get into somebody's body? And there's 4 major areas that we're going to look at, 4 major approaches. The least invasive of all of them, of course, is the topical application of a medication. This is sometimes called the local application of a medication. And this is for external infections, infections of the skin. And with this kind of application of a medication, typically the blood levels of the medication are quite low. That's not always the case, especially if there's a transdermal patch, for example, and the whole point is getting it into the bloodstream. But for most medications that are applied topically to like a local wound, there's not going to be a huge amount absorbed into the system. Then the next more invasive route of administration would be an oral route. So a patient takes this medication by mouth. This requires no needles to get into the body, and the patient can self-administer. The trickiest thing with oral route medications is it has to go in through the digestive system. So one, it has to be stable at this very low pH in the stomach. It's going to be chemically modified through the digestive system. And so there's a lot of engineering in some sense that goes into these medications before they can even get into the patient. Then we will have a look on the next slide what that does to blood levels of the medication. If we need to get blood levels higher faster, then there may be an intramuscular administration of the medication. This delivers the drug via a needle into a muscle. That is the way of getting it into the body quickly, into blood levels elevated. The problems with this, one is most people don't want to do this to themselves, and 2, the medication dose tapers off pretty quickly. And finally, the most invasive way of getting a medication into the body is through IV administration. This delivers the drug directly into the bloodstream. So in preparation for this, an IV needle has to be placed typically by a medical assistant or a registered nurse would do the application of the IV needle. And let's have a look. So we're going to look at the blood, what happens to the blood levels of the medication with these 3 routes: oral, intramuscular, and intravenous. So on the x-axis, we have time in just a few hours, and on the y-axis is the relative concentration of the medication in the blood. And this was the least invasive way, get the medication by mouth. And initially, the medication dose is very low because it's got to go in through the mouth, it's got to get into the stomach, it's got to be absorbed through the intestines, and then finally we start seeing some amount coming into the bloodstream. But that's going to taper off, and then the patient would have multiple doses in the day, most likely. Intramuscular, this might be administered, say, if the patient is in the clinic for a severe infection, but it doesn't require very well, if the infection is significant but doesn't require hospitalization, while the patient's in the clinic, the healthcare provider might prescribe an intramuscular injection, which an RN would administer. The advantage is, whoa, look at that. We get the dose of medication into the bloodstream quite quickly. The problem with this is then there's a pretty quick decrease in the medication as well. But at least that would get it started, and the patient might be given an oral medication at the same time. And then eventually that oral medication will be the way the doses continue being administered. And then finally, the most invasive way of getting an antimicrobial medication into a patient is through IV. Giant advantage is very quick input, and you can keep the dose quite high. This would require hospitalization for a patient or possibly administration at home, but with home health care. So that's the big advantage, is you can get the dosage high and keep it high for an extended period of time to fight off especially serious infections. Okay, let's talk a little bit about safety and side effects, though we did touch on this previously. We have to be concerned about toxicity. Of course, we prefer selectively toxic medications, things that are going to affect the microbes more than they're going to affect us. But we do have some side effects. The cause of some of the adverse reactions are not well understood. And so we don't really know how to what to do about it. And sometimes we can't even guess who's going to have an adverse reaction to a medication. Some of the places where we see toxicity, especially to the two kinds of filters we have in the kidney and the liver, a lot of the medications are metabolized in those places. And so that's where we see some damage, and sometimes we see some nerve damage occurring. There is a particular antibiotic medication that I can think of that can lead to tendon ruptures, ligament ruptures, but quite rare, but they do happen sometimes for some patients. You need to be very, very careful. One needs to consider the medications prescribed to pregnant women. Typically, medications, we try to avoid giving medications to pregnant women because sometimes the side effects, especially of newer medications, we just don't know. For example, the case of thalidomide was a medication that was prescribed to pregnant women for nausea. Thought very safe, just helps people not feel quite so sick all the time. And it wasn't until much later that it was discovered that some developing fetuses ended up having blood supply problems, and so limb buds didn't get to grow completely, and so there's a whole generation of thalidomide babies, they were referred to, as their moms had taken thalidomide during pregnancy to help with nausea and inadvertently had this side effect of not allowing the limbs to grow. So we err tremendously on the side of caution when considering what medications pregnant women can be given. We consider the therapeutic index of the medication. That is the ratio of the dose of a drug that can be tolerated to the drug's effective dose. So what you want is a very high amount of medication that can be tolerated, but you only need a little bit of that. And so the way that that's expressed is like, how much could somebody take of this medication and survive versus how much do they really need? And the more you could survive on, and the littler this number is, we want a good therapeutic index. If the amount that a patient can take is this much, and how much they need to treat the disease is this much. Think arsenic, like trying to treat syphilis with arsenic. Like, you just don't have a lot of wiggle room there. That's therapeutic index. And finally, some side effects. Here are some striking photos. Here is the teeth I'm going to cover first. This is what would happen if, for example, tetracycline is prescribed to a pregnant woman. The developing fetus's teeth, I know that they're born without teeth, but the developing teeth get stained. It gets even worse when the teeth are exposed to sunlight. It's even browner. This is permanent damage to these teeth. In contrast, I am not making this up. This side effect is referred to as black hairy BHT, and it's completely harmless. And it's a temporary side effect that some people have to some antimicrobial agents. So these are things to consider, and things that clinicians need to be on the lookout for, because this doesn't happen clearly. Presumably this isn't something that you see a lot in clinical trials, and so it's going to come up in clinical practice. So black hairy tongue, temporary, the teeth staining, permanent. Last slide for this section, safety and side effects continued. We have some patients experience allergies to medications. That means that their immune system is overreacting to the presence of this medication. The allergic reactions are relatively rare, but they can be life-threatening. For some people, particular medication can cause them to go into anaphylactic shock, in which case the airways start to shut down. And although the infection itself was creating problems, this reaction is going to be even worse than any infection anyone could have had. And then finally, something that we have talked about before, the disruption of the normal microbiota. We have a whole world, a whole ecology of microbes living in and on our bodies. And taking an antimicrobial agent is going to disrupt that microbiota. This can result in secondary infections. That is, a different microbe can come in, or the overgrowth of the normal flora, which causes what we call a superinfection. And the classic example of that is a yeast infection, a vaginal yeast infection. In fact, for some women, it is so common that as soon as their healthcare provider prescribes an antibiotic, they just go ahead and give me an antifungal too, because that's coming also. All right, and that is, oh, this is of greatest concern for hospitalized patients. Remember the graph for the blood levels of the IV antibiotics. There's a big increase and then it stays high for an extended period. That is going to disrupt the microbiota more than anything else. And the patient is going to be exposed to lots of bacteria in the hospital, especially already antibiotic resistant bacteria. So yeah, this is a tremendous concern for hospitalized patients who are on long-term antibiotic treatment. All right, and that is the end of part 5. See you over in part 6.